Hi, my name is Larry Odero, and together with my team, that is MindMerge, we are building InfectTrace. InfectTrace is a digital solution designed to empower healthcare workers and protect patients by transforming infection tracking in Kenya's hospitals. So, in Kenya's public hospitals like Kenyatta National Hospital, infections control teams still rely on manual paper-based data, and this process is slow, it's inefficient, and definitely it's prone to errors. And the impact is huge because outbreaks are detected too late, responses are delayed, multi-drug resistant organisms, that is MDROs, spread faster, and ultimately patient safety is put at risk. So I'd like you to meet Chris. Chris Otieno is a 32-year-old infection prevention nurse at Kenyatta National Hospital. Every day, Chris has to deal with late, incomplete reports and manually enter data into logs that take hours to complete. He doesn't have a reliable system for fast, accurate analysis, but what he needs is clear: a digital tool that can make infection data instant and reliable. And this is not just a local problem. Multi-drug resistant organisms cause 1.27 million deaths globally each year, according to the World Health Organization. And without timely data, hospitals are always a step behind in managing this. At Kenyatta National Hospital, studies by Cambridge show that manual paper-based records increase transcription errors by 35%. In other words, more than 1 in 3 records contain mistakes that can cost lives. Now, contrast that with real-time tracking. Systems like these can cut outbreak responses times by half. That is by 50%, according to the CDC. Faster detections and definitely faster detection means faster actions, and ultimately, lives are saved. So this is where InfectTrace comes in. InfectTrace is a mobile app for real-time infection tracking and outbreak management. It reduces errors by eliminating paper-based transcription, and it also provides instant access to information data from any device. It also allows hospitals to respond rapidly to outbreaks before they spiral. I'll give you a sneak peek of so this is a sneak peek of InfectTrace. And so with funding, I will roll it out in 4 phases. First, we'll launch a pilot program in a partner hospital. And then secondly, we'll train staff to use the system. And then thirdly, we'll scale the solution to more hospitals. And finally, we'll integrate it with the Ministry of Health to support a national surveillance system. Identifying infections earlier, patients receive safer care, hospitals prevent avoidable harm, and ultimately lives are saved. And together we can make infection preventions smarter and stronger. Thank you. So infectious